I would like to speak to you about three instruments that we've developed: the Trujillo hook, rake, and the wedge, developed for LASIK surgery, but more specifically for LASIK enhancements. We have discovered that not all pre-existing flaps lift up the same. The combination of these instruments mentioned should give you better versatility in dealing with them. We'll be showing the instruments in finer detail as we proceed. We have found that the light source, due to the angle from refractive laser systems, is never enough to fully distinguish a pre-existing flap margin. Consequently, the margin is better identified and rescored at the slit lamp. This can be accomplished with a LASIK hook. Once the patient is on the laser bed, the rest of the pre-existing flap margin should be rescored. This next step should be to keep the margin intact, which helps with epithelial undergrowth. This can be accomplished with the LASIK rake. Continuing with the process, after the flap or the entire flap is rescored, the flap does need to be pulled back, and this can be accomplished with the LASIK wedge. I want to talk a little bit about the features. Designed specifically to consistently rescore at the slit lamp an area of pre-existing flap margin on LASIK enhancements. Special rounded post design that helps preserve tissue margins without the tattering effect. It's got a unique angle design for greater control and better distribution of pressure. The easier application to the flap margin without interference from the slit lamp light source. It has some applicable utilization and certain enhancements at the laser, and superior to other non-LASIK enhancement marking instruments in durability. The next instrument is the LASIK rake. Some features about that is it's designed specifically to rescore the entire pre-existing flap margin by using a clockwise, counterclockwise motion. It has a special two-post spacing design that addresses more flap area at one time when you pull back. It's got a unique design that allows better distribution of force needed to start the flap lift. And last but not least is a special post-treatment for better gripping action. The last instrument is the LASIK wedge. Some features about the wedge is designed specifically to lift the entire flap in a uniform manner by pulling towards you in a side-to-side motion. It's a unique wedge that helps decrease inadvertent flap stretching by addressing more flap surface area, which may affect the flap from seating properly. It's a special wedge angle and apex to allow better flap lift. It also has an applicable utilization as a modified applanator when trying to stretch out a certain area of flap margin where the gutter is too wide. you.